This meeting is being recorded.
Good morning. We have been looking at the child developmental cycles and how children learn, as suggested by Rudolf Steiner as part of anthroposophy. We looked at the 3 stages of child development from birth till about age 7, from 7 till 14, and 14 till 21. In the first stage of child development, it is about the physical growth and children learning through imitation. Second stage is about emotional development and children needing a loving authority. And the third stage was about the intellectual development, where children are seeking to explore the truth. And yesterday we looked at how should an adult be as a parent, as a caregiver, as a teacher, so we become worthy of imitation. Are we to an extent where children can imitate us? So we looked at different aspects of developing ourselves in terms of my talk, my gestures, my words, my actions, my behavior. Is that all worthy of imitation? And we put efforts in refining, developing, evolving ourselves. Despite our best efforts, we do see children having challenging behaviors or something that we can label as misbehavior. And I really don't know if it is a misbehavior because I don't know if I'm right. Child is the product of environment. So it is not just one person who is influencing the several other factors that is affecting the child's development or behavior. So what kind of behavioral challenges do we see in children? What is the difficult behavior? It could be a behavior that disrupts or harms the rights of others, the rights of the child himself or herself. It could be that the child is harming the environment around. It could be a behavior that risks or put other children at risk. Pinching, pushing, pulling, yelling, screaming, all these kinds of behaviors that the children exhibit. And many of these behaviors or misbehaviors are a call for help. The child is unable to communicate, and hence communicating in the language they know that we can label as misbehavior, but it's really child seeking, wanting help to know how to do things better. Are we able to identify this is something that we need to be exploring. Some of these behaviors could be affecting the child's ability to learn, ability to focus, ability to socialize. Do they know how to be, when to be, what to be or what not to be in any given situation? Are they able to sit in a place and focus on the task at hand? Are they able to manage themselves when they're outside in the ground with their friends? There are many such simple behaviors that do not get accepted in the society, get labeled as misbehaviors. We need to be extremely careful to not label the child because of certain behavior. So something, calling a child something like you're lazy, or you are not interested, or you're disruptive, whatever is going to affect the child. However, this particular action is not acceptable. This particular way of talking can be modified, suggestive things. One other thing we need to be careful is what I'm saying is right may not be right according to you. So I need to consider that as well, that what is right is subjective, it's a perception. So in a setting of a school, if 5 teachers are having similar problems, similar issues with a child's particular behavior, then you can assume that it is a child's behavior that needs to be modified. What Steiner calls here is bringing into balance. There is an imbalance. That's why child is behaving a certain way. The bringing into balance. It is not making a bad boy become a good boy. It is not fixing of certain behavior. Because I myself am not sure if my perception of that behavior is right or wrong. If in case we have different opinions about the child's behavior, math teacher says he's very involved, PE teacher says he's like a leader, social teacher says he writes very well, only the English teacher is having a problem, then it may not be the child's behavior that needs to bring into balance. It could be teacher's perception that needs to be brought into balance. So either ways, it is going to help establish balance in the system where the child feels comfortable, the adult feels comfortable, so we kind of get into a flow of learning. So the example we talked about was about a child pinching. Why does a child pinch? We don't know. It could be to get attention, it could be to express frustration, it could be um, to just tell that this space, you're occupying my space, or to just tell you to move away a bit more, whatever. But then when I label the child as this child is pinching all the time, then we are empowering that behavior. We are paying attention to it and empowering it. And many of the times we have experienced that this behavior does not change by just advising the child not to pinch. So we need to find an alternative if this is a consistent repetitive behavior. And one of the ways to fix it is through telling therapeutic stories. Making up of a story. Teacher needs to make this up of a story that describes the behavior and also suggests an alternative behavior. So somewhere without directly talking to the child, we are bringing into the consciousness that something I'm doing isn't right, but there is another way to get what I want by doing something else. And this doesn't happen when someone tells a story just once or twice. It has to be told repeatedly as part of the classroom rhythm several times very consistently until there is a shift in behavior that happens. And this benefits everybody. It is not just the child who is having the problem that's getting benefited. It also sinks into others to accommodate, to accept, to support, to balance. And as far as adults are concerned, it's also giving me a perspective to go a little deeper into the child's psychology to see what could be making the child pinch. What is stopping this child from expressing? What is that other child sitting next to the pincher creating for this child. So the defense mechanism is pinching. So it gives us an opportunity to delve a little deeper into understanding the child a little bit more by understanding ourselves a little bit more. So in this process, a whole lot of learning happens in the community, in the classroom, in the house, and every one of us is benefiting and shifting. So the key thing is understanding who is doing that behavior. Who is not this girl is pinching, but who in that child is wanting to do this? What is that inner motive? Is there somebody external who is instigating this behavior, who is challenging this child to do something stupid? I mean, this you see a lot happening in the middle school and the high school years. And next is to identify what is that behavior. In this particular case of pinching is the behavior. And when does this behavior occur? Is it happening all the time? Is the child constantly pinching one or the other? If she doesn't get hold of people around, maybe is she pinching her eraser away? Is she pinching her bag away? Is she pinching herself? All these are to be considered. When does this happen? Does it happen right in the morning or Monday mornings or after lunch or before going home or on the bus? Different situations. When does this behavior happen? And where does it occur? In what context is it occurring? Is it in the school? Is it outside on the playground? Is it only at home? Is it only, many a times we hear parents complain that the child does something at home, but the child is perfectly fine in the school. And at school, we say, parent, take care, he's running around in the classroom, but he's perfectly fine at home. So it's also important to consider where is this behavior happening and how does this behavior manifest. In our case, with the pincher, we know it manifests as pinching. But now, how does it really, we do look at how it manifests. Now we have to look at the causes of that behavior even coming to the foreground. So the answer is therapeutic stories, where these are soul soothing, teacher made, tailoring to that particular classroom for that particular child of that particular age with that particular set of friends that he or she has, and bringing consciousness for everybody, including myself as a teacher or a parent, and using these stories regularly in the next few weeks, few months sometimes, to help child understand alternative ways of doing things, to understand the consequences of my action, not through telling the morals, not through advising, but the child herself will feel the shift within and start practicing the alternate behavior. And we will explore more of therapeutic stories tomorrow. Thank you.